This is Bodywork Therapy Seminars, and this is Myofascial Release class. I'm Tom Maxson, and we are about to put on a Batman suit on my lovely volunteer here. And this is a one-piece bodysuit, kind of onesie PJs. Yeah, I'll let you do that. You don't really need my help. We're going to duct tape some myofascial meridian lines down the entire coverall outfit. We have the hoodie on so we can get all the way up to the occiput on the superficial back line and around through the anterior neck and SCMs in the superficial front line. And if you would, lie on your back on the table, please. We're going to put these socks on, or you can put the socks on, they're kind of tight, which is the purpose. There's a whole lot of fascia and connective tissue around the ankle, around the heels, tying everything into place. Definitely doesn't have to be perfect. I don't feel like I'm helping at all. So let's do, and I need some help from the crowd to help do this. We have two sides, so we have some volunteers to take down. You can do one long strip all the way from, we're doing the front line first. It's going to start up kind of behind the ear at the occiput. And just follow the track right down the diagram. This is Tom Myers Anatomy Trains, superficial front line. We're doing some postural assessment, trying to understand where strain patterns are happening. Right, go straight through the quad, down the abdominals, tibialis anterior, all the way down to the dorsal side of the foot, through the toes. And just snap that off there. Beautiful. Thank you. And other side, matching.
Hair.
Please help.
Oh, and you got in your hair.
Hurt anything important? Did you have any idea you were going to dress up as Batman today when you woke up?
No. And be duct taped.
Come to class?
Right.
And while we're here, let's work on the spiral line. That one, perhaps. So we're going to need you to sit up, straight up. Notice, as she sits up, there's bunching in the abdominal region of the superficial front line, and some here in the inguinal area, and that could affect stuff going on in the feet. In fact, in reflexology, we talk about the dorsal side of the ankle is connected to the groin muscles. And we can see that's exactly connected. As she does a crunch or a sit-up or any kind of abdominal workout or movement, there's going to be a fallout somewhere with physics down the line on the top of the foot, as well as the inguinal area all the way up through the chest and possibly the neck, because it's all one big picture. So right, that's going under the arm and crossing over kind of the navel area under the a little lower than the sternum.
That don't.
Sorry, it's your abdominal muscle.
So it comes out here, right? To you. Right.
Right, on the opposite opposite IT band, which is interesting. The spiral line sometimes will reveal some,
And then it goes to the side of the ankle.
yeah, kind of scooping under like a stirrup,
It's
all the
like
way
this.
up under here into this, like, yep, and you can stop right there. And then we're gonna start from the other side, like right up.
Oh, it's higher up.
Actually, I'll just
Put it on
just
the right side.
leave that one there. And that'll just connect a little bit longer. Up to the head.
From the opposite.
So it kind of goes down and around the whole rib cage under the arm. So start that one with it. At the occiput, down and around. I'll let you ladies get personal. So I don't have to. And crossing over the navel area into the opposite side. So this will reveal a lot of imbalance and dysfunction that people have in a twisting, spiraling, torquing kind of situation. Right, and that loops it around the foot. Thank you. And if you would, lay back down flat, if you can. And turn over so you're prone,
That's gonna be
please.
easy.
You can move up into the face rest here. So now the back line,
Here.
maybe backwards again, superficial back line. Now it's much easier, straighter kind of situation. Occiput down the erectors,
Foot, right?
longissimus multifidi, all the way down to the
Bottom heel.
calf and the heel, yes,
Under, right?
and the plantar surface of the foot. See all the way to the plantar big toe on the diagram. So we need one more line for the right side. Down the erectors through the glutes, hamstrings, calves, plantar surface of the foot to the big toe. Beautifully done. Thank you. So let's put this down again somewhere like that. All right. So what can we see? There's crossing over here. How often are people stuck together right in between the shoulder blades? Or down in this area? Or there's stickiness in this junction? You see what I mean?
Yep.
Or stickiness here where the head doesn't want to rotate, the cervical spine doesn't want to let go enough to have extension and good curvature, military neck kind of thing, because there's all these opposing forces that can be out of balance. The spiral line is coming around, even the front line is coming up to the anterior occiput and the rear occiput. Like how many people have tension headaches and migraines just from there? The slight imbalances. Does not take much to make this angry if you're in a habitual pattern of sitting at a desk or working in a way that irritates that. The brain, something a lot of people don't know about is that the brain's top priority, a lot of times posturally, structurally, is to keep the eyeballs level with the horizon. So the first way the brain does that is by adjusting those tiny little suboccipital muscles along the base of the skull. And if that doesn't work, if there's not enough range to get that slight, minute movement to even out the horizon, you're going to start getting deviation in the shoulders or in the hips. And if you're sitting at a computer and you're always looking at this screen and you've got another screen over here and you're looking down at a paper and up and over and down and up and over, you're going to have this constant firing of all these fibers of muscle in the base of your skull. And you're going to get imbalance pretty fast doing that. So, talking about assessment, we can do very easy movements. This should be super comfortable for the client on the table while you're doing this little rocking motion, rock the baby to sleep. This is super soothing to their nervous system. We're trying to respect the nerves and tell their brain this body is in a safe place. We are being therapeutic to you. We're not going to beat you up. We're not going to dig our elbows into your spine. This should be a nice experience. And we can see, is something moving or not moving? Which leg has more mobility in it with this rocking motion? Is there, this seems stiffer than this side. But, you know, it's subtle, not a lot in this case. The spine should have a nice serpentine kind of pattern, and I'm not seeing a lot of movement in the top half of her back or neck. This feels pretty decent in the lumbosacral area, but I'm not seeing a lot of movement here. So I know I'm making mental notes. I'm going to focus a little more on this part. But even as I move this, can you see anything move down here? Like her ankles and heels haven't stopped moving, and I'm really not putting much pressure up here. So just start thinking in bigger picture terms as you think through this material. And if I cross over here, I can like see some movement through here where the tape is pulling, the fascial line is pulling. If I go down to the ankle, what kind of movement do I see elsewhere? I'm seeing like a little bit of moving here. You can see the like light shimmering on the tape. I can see movement here. So there's a lot of forces at play both ways. Each side counterbalancing the other side. Front to back, side to side, up and down. We are three-dimensional people. I'm going to say that 100 more times today. If I do something like this, you can see, I can feel a lot of tension happening here. If you want to grab this leg and kind of feel how that catches. But then we have slackness on the backside, where that was like right on her heel. So if somebody has a lot of foot tension, ankle tension, your runners, your basketball players, jumpers, people who are kind of ankle intensive, dancers, just that little rotational movement is creating a lot of movement here, like even up to the head. I see the head kind of shifting a tiny bit. Again, I'm not doing any work. I'm just shaking her foot around. I could get a lot more vigorous. I'm still not doing any work, per se. I'm just barely standing here. I'm not muscling her body to do something. And I'm getting a lot of information of what can I touch later, what needs the priority of the limited amount of time that we have, because there's always a limit of how much therapy can I possibly give to her, how fast. Like that's how we set up the treatment plan, right? This is the first time I'm seeing her. I'm taking a couple minutes to go through this kind of thing and assess what's going on. Probably this side. Another thing we can look at is, like I was saying with the spiral line under the arm into the lat kind of area here. This is an area that a lot of massage therapists don't touch very much because it is very tender. It's very personal space along the rib cage and up into the armpit. There's a lot of lymphatic tissue there that you don't want to disrupt. Breast tissue, the respiration muscles, serratus anterior, all of that's very shallow material, and as soon as you start poking in directly, it's ticklish, it's real nervy and uncomfortable, right? So if I start moving the arm, which is super comfortable, it's very safe ground, right, for me to touch the forearm like a handshake, right? This is completely safe for me holding her arm. And again, I don't want to do much work, so I can just sit here or sit on a stool and move the arm a little bit and assess, like I'm seeing movement here, I'm seeing movement here, all the way through the abs. And if I'm going to stretch, assuming she has no joint vulnerability or injury, you know, safe to move and stretch, which I didn't ask first, but she's not yelling at me. So is this comfortable? So this should be super easy for me to do. I do this sitting on a stool most of the time, and it's super effective. She should be feeling this all the way through the side, as if that spiral line is getting slowly, gently stretched out. I can also kind of change the angle and stretch that part out longer, kind of a lat stretch. And I'm just putting some pressure on the elbow towards myself. And I'm not even using my arm strength. This is just kind of hanging here like a hammock, and my upper body and hips are pulling back. I'm leaning against her, falling into as much space as that allows me to go. So, super lazy. I'm just hanging out here. Changing, somebody's trying to do something for your good. What was I gonna say? Another reason I like that number, that timing, is that it takes about 11 breaths for your blood that's in your heart right now to circulate all the way through your entire body and be back in the heart, to go through the entire circulatory system. So if you've had a neurological change, if your brain is realizing something's happening to me, I need to try to balance out what's going on. If the brain is going to send out hormones, endorphins, any kind of chemical change, it has to go from your brain or wherever in the body those substances are being produced and put into the bloodstream. It's going to take about 11 breaths for it to circulate everywhere. So 90-ish seconds, if you're comfortably breathing, is about that same amount of time. So I like that, to give your body time to react to me. I don't want to force you to do anything. I don't want your brain to think I'm attacking you. Because if I start attacking you, your brain's going to put up walls and barriers against me, which is the opposite of what we're trying to accomplish, right? And if you would, please turn it over on your back again. Almost done. Breathe easy again. So again, if we kind of do that same motion of the arm from the top side, you can see kind of where that's going. There's pull all the way across here and into that hip is moving. And if they have more limited movement of the arm, it's probably more comfortable for them to do it while they're supine. So you can just put a little bit of pressure here and assess how much bounciness they have. There's so much fabric right there right now, it's not going to move. But you can also, thinking three-dimensionally, stuck to the blanket, drop a leg off the side and see how that line affects all the way from the toe all the way up through the knee. People with knee pain who've been training for a marathon, for example, will have no idea that their respiratory muscles up here and the lat could be holding on so tight that it's causing discomfort and imbalance in the knee on the other side. So, and we did like the lat stretch. This is going to be related to that knee over there. So even just cluing them in this much, even just getting them on the table and throwing a leg over the side and putting a little intention here, a little pressure, and again, I'm just leaning, very soft, flat fist, couple compressions here, is gonna engage her mentally, engage her brain that this could be better. How can I make this better? How can I make this more comfortable? Why am I holding it like this? Why am I not performing as well as I could be? And your brain is going, her brain is gonna start relaxing tissues and moving fascia around and heating stuff up and sending more blood flow and more oxygen where it needs to be. As it moves into parasympathetic rest and digest and heal mode. And all this time I'm thinking, I'm assessing physically where things are, and her brain from the inside is thinking where things are. So I only need to know on the surface what are the superficial lines telling me, and that's going to clue me into a lot of stuff that I didn't know before she came in and laid down. Any other questions about that? Making sense?
Making sense.